Hello everyone, Rob Arnfield speaking to you from the Division of Critical Care Medicine at Western University. This tutorial will focus on the practical aspects of sterile technique for invasive procedures. This tutorial will review the practical aspects of using sterile technique for central venous access of the internal jugular vein. The same technique, however, may and should be applied for other invasive procedures in the ICU, emergency department, or the operating room that require a sterile technique. It's in the guidelines of virtually every medical society and health organization known to man, including LHSC, that all central venous access must be achieved using maximal sterile barrier precautions. This approach is associated with a significant reduction in the risk of a potentially lethal central line infection. Maximal sterile barrier precautions should include a cap, mask, sterile gloves, sterile gown, and a full sterile body drape. Additionally, for central venous access, you'll require a sterile ultrasound probe, a central line kit, and an extra set of hands. To take us through this sterile technique, we fortunately have an expert intensivist and anesthesiologist in Dr. Jeff Granton. Everyone say hi to Jeff. Hi, Jeff. For a sterile approach to a procedure, there's a fair amount of stuff you're going to need. You should gather it and place it on a bedside table or equivalent. Having a garbage within free throw distance will also help to minimize clutter, and is indeed the mark of a discerning and highly skilled proceduralist. Increasingly, we're seeing the pre-assembled bundles of all the gear you require for central venous access, but these are not yet universal, so this tutorial will assume the need for complete self-sufficiency. Once you've gathered the necessary supplies, attention to positioning the patient, including Trendelenburg, initiating any additional sedation, and patting the bed for some blood loss that may or may not occur should be considered. You may then prepare yourself for the procedure. Start by removing your jewelry on your hands. Then proceed to wash your hands. A sink washing is preferable to the waterless cleanser. You should then prepare as much as possible while remaining non-sterile. This will improve your efficiency and minimize the risk of becoming contaminated once you've become sterile. At the minimum, you must obviously put on your cap and mask while not sterile. Many will also choose with close attention to open the central line kit itself and using the sterile surface of the open kit to place other sterile items, such as green towels, gloves, ultrasound gel, and the ultrasound sheath. Now it's time to gown up and glove up. Open the sterile gown packaging. Unfold the gown in front of you and push your arms through without pushing your hands beyond the cuffs. Then ask your friendly assistant to tie you up at the back, just the upper ties. Now, use your stumpy, cuff-contained hands to open your gloves and put them on without any skin contact at any point. Ideally, the gloves should cover the cuffs of the gown when you have finished your task. You then prep the skin with chlorhexidine swabs twice, sterilizing a generous area surrounding your procedure site. Then, either using sterile green towels, which are commonly preferred, or the fenestrated drape that comes in the central line kit, you begin creating your sterile field. You complete your sterile field by using a long sterile drape to cover much of the patient's body. While this step admittedly seems a little excessive to many, it is required and will provide a large sterile area to work in and to set your instruments, including the ultrasound probe and cord, as we'll show you later. If the patient is not under general anesthetic, you should introduce local anesthetic at this time. If your procedure is ultrasound guided, such as the internal jugular cannulation depicted in this scenario, you should now prepare your ultrasound equipment. In addition to the machine, you'll need an ultrasound sheath and sterile gel. Non-sterile gel is not acceptable. Instead, be sure to find the ultrasound gel found in the sterile packets. Open the sterile gel and apply the gel into the sterile sheath. If the sheath does not come compactly rolled, be sure to roll it up so you can apply the gel directly to the farthest part of the sheath, against which the ultrasound probe itself will ultimately be in contact. You're now ready to ask your assistant to help you carefully introduce the ultrasound probe into the sterile sheath, coated with the sterile gel. You must be cautious at this step to avoid contamination. Once you have control of the probe from within the sheath you're holding, ask your assistant to let go of the probe and support the cord as you advance the sheath to cover as much of the cord as possible. Once you have good distal and proximal control of the sheath, as shown here, your assistant should then take any remaining sheath and pull it back over the cord without any contamination. To keep the sterile sheath tight to the probe, milk the air from around the probe while concentrating the gel at the ultrasound probe surface. Then apply one of the elastics that comes with the sterile sheath to preserve this arrangement. If by chance you aren't yet ready to start your procedure, you can now use your large drape to your advantage and set the ultrasound probe on it. It is expected that if you have a long enough sheath that some of it will come in contact with non-sterile areas of your environment. It remains your task to avoid cross-contaminating these parts of the ultrasound sheath with your sterile field. You may then apply additional sterile gel to the skin surface to assist with ultrasound image formation. You have now satisfied the requirements of maximal sterile barrier precaution and are ready to start your ultrasound guided procedure. Lastly, a couple pitfalls to avoid. Be mindful of your surrounding non-sterile environment at all times, just like in the operating room. This is especially true at the head of the bed where rails or poles can easily get in the way. And no matter how itchy your head or face become, avoid contamination. Also, be cautious that your sterile towels or drape don't migrate during your procedure, leading to exposure of non-sterile skin that may jeopardize the sterility of your field. And last of all, if somebody identifies that you are doing things in a less than sterile fashion or have inadvertently contaminated yourself, have respect for what is said and praise them for their skills of observation, and please address their concern. The science of being sterile is easy after all, but it's the behavior, the dexterity, and the organization that we all struggle with sometimes, and we can all use a little bit of help. This concludes this tutorial on the practical aspects of sterile precautions for invasive procedures. Special thanks to Dr. Jeff Granton for his superb modeling. If you have any questions related to ultrasound activities at Western University, please check out uwsono.ca or contact me. Thanks for listening, and so long for now.